Today, we are talking about misconceptions of hormone replacement. I'm Sharon Lemoine, nurse practitioner and owner of Gig Harbor Medical Spa and Gig Harbor Concierge Medicine. We're going to dive in today, but if you're really interested to learn more about hormone therapy, make sure you check out our other YouTube videos, like and subscribe, and if you're really interested and want to keep up to date, hit that notification button and you'll be notified of all of our new videos upcoming. So what are some of the misconceptions with hormone therapy? I always like to separate men and women when I'm talking with my patients. The biggest misconception, and we've talked about this before, is that replacing hormones in women will give you breast cancer or you're going to have a stroke. This was all based on the Women's Health Initiative, the biggest research project on postmenopausal women on synthetic estrogen. That information was wrong. However, it changed how we treated our patients. The pendulum is swinging, that correct information is out, and the research has gone on to prove the benefits of hormone replacement. So in women, people think, am I going to get breast cancer? The truth about that is estrogen does not cause breast cancer. If you do get breast cancer, estrogen can feed those cancerous cells. But again, it does not cause. There's also that misconception that it causes blood clots. If that were the case, when our estrogen levels are the highest in, let's say, our 20s and 30s, why aren't all these women having very high incidence of breast cancer and blood clots? So good question to ask. So another misconception is if you give women testosterone, they're gonna grow a beard. They're not gonna grow a full-on beard. But you might have some increased facial hair growth. This happens with aging. It might be a little bit more prominent. You might find that you gotta shave your legs a little more often, but women quite often don't mind this incidence of hair growth because of the benefits being life-changing. Another misconception for women is I'm gonna get a really deep voice and I'm gonna sound like a man. Can this happen? Yes, but I have found most often these patients are doing very high doses. Their levels are not being monitored by their doctor. And that is something that, of course, we watch for. And if managed correctly, this should not happen. So misconceptions with hormone replacement for men. One thing is men don't need hormones. They have plenty of testosterone. In actuality, at around the age of 30, men start losing testosterone 1% to 2% each year. So if you fast forward 1 or 2 decades, they're definitely depleted. What does this look like? Some of the symptoms of low testosterone in men are fatigue, lack of motivation, low libido, weight gain. Sound familiar? We might know people like that. The technical name is called hypogonadism. This is where the production of testosterone is significantly decreased. Now, in younger men, there can be a medical condition causing this, and these are things that we definitely want to pay attention to. For men that are middle-aged or older, typically it is the part of a normal aging process, and just like women, they need testosterone replacement for better healthy outcomes. There is a stigma that if men have to have testosterone replacement, that makes them less of a man. That is a misconception. That is not true. It's just like replacing a supplement. It is all about feeling your best now and preventing disease down the road. Another misconception is that hormones only relate to the sex hormones in both men and women, and this is very much untrue. It relates to heart disease. It relates to the lack of, preventing dementia, preventing bone loss. So there's so many areas where hormones affect our bodies, metabolically, systemically, aging. So we really like to look at the misconceptions and set our patients straight and educate you so you're making an educated decision on if this is right for you. So research shows that metabolic syndrome, hypertension, diabetes, sleep apnea, a sedentary lifestyle, all of these things can relate directly to low testosterone. In comparison, by replacing your hormones and getting them balanced, if these are already happening, we can reverse this and we can most certainly prevent it. As a patient advocate, I am trying to educate my patients that they are in control of their health, and hormones certainly is a very big piece of the pie. So I often talk about different types of hormones and delivery methods. So there's a ton out there. Many women are familiar with patches, creams, vaginal creams. For men, they're very familiar with injectable testosterone. This is once or twice a week. Here at Gig Harbor Medical Spa, we favor pellets. And what I love about this is, number one, it's convenient for the patient. They only have to come see me every 3 to 4 months. We insert the pellets, they get to get on with their life, and they don't have to worry about a daily dose. The other thing I really like about pellets is absorption. We're trying to get those blood levels up to a therapeutic level, and with 97% absorption in a pellet, this allows us to get those therapeutic levels up. Now, with that said, this might not be the right method for everybody. There are patches and creams. We're looking at about a 40% average absorption rate, but for some women, this might be perfect and address their symptoms and they feel much better. We're talking a little bit about misconceptions, and the biggest topic can be injectable testosterone. I look at this very carefully. For some men that are being followed very closely by their doctor and dosing appropriately, this can be fine, but there are some side effects. The idea with testosterone and injecting, you're taking a decent amount all in one dose. This can drive up heart rate and blood pressure, and over a long period of time, this certainly can affect heart health. So this is something that we monitor very, very closely. The other big difference is bioidentical and synthetic. Now remember, Women's Health Initiative, they studied synthetic estrogen. This is where there was questions on, is this causing health issues? In the background, all the research was still going on bioidentical. This means the chemical structure matches exactly how you produce it in your body. So of course, we all want the most natural approach, and this to me seems like the best option for my patient panel. Okay, so as you know, we have talked a lot about hormone therapy and the benefits. Make sure you subscribe to my channel and watch our prior videos where we really dive into the benefits of hormone replacement. Just to recap, by replacing estrogen and testosterone in women, we're reducing breast cancer by 35%. We're reducing cardiovascular disease almost by 50%, bone loss, dementia. These things are huge, and to prevent disease, this is huge with hormone replacement in women. Now for men, very similar, preventing heart disease, dementia, bone loss, better mood, helping maintain and build muscle mass. Why is this so important? Number one, Americans are in a metabolic crisis, and a lot of it relates to insulin resistance. The idea is more muscle mass, less occurrence of insulin resistance. This is huge metabolically. I know it's a very hot topic, but we can't ignore how hormones play a part in this. Overall, with more muscle, we're also protecting our body and supporting our bones. And I always tell my patients this one statistic I heard that really hit home for me. If you are over the age of 50, regardless of prior medical history, if you fall down and break a bone, the chances of death in the next 12 months is 50%, which is crazy. So we're all gonna fall. We can all be a klutz and we can have accidents, but we gotta be able to have our bones sustain that fall to not put us at high risk for other issues. So overall, the benefits of hormone replacement is a hot topic. We are learning more and more, and I think that pendulum is swinging in the medical field of opening our eyes to how it plays such an important part in overall health and longevity. So we love educating our patients and we love your engagement. So make sure you like this video and subscribe to our prior videos. And let me know what you guys think. If you have questions, what's the biggest misconception that you've heard? I would love to answer your questions and get to know about your needs. And again, we are in Gig Harbor, Washington. And if you would like to come into our office and learn more, feel free to reach out.